We leave the news, the newspapers, to talk about a particular disease, occult tethered cord. We do so with a guest who joined us in the studio, neurosurgeon Vani Veronesi. Good morning and welcome back. The professor operates in the hospitals of Faenza and Lugo, so in Romagna. Professor, let's talk about this occult tethered cord and what it is, what pathology it is, why it is so difficult to diagnose.
Occult tethered cord is a rare condition that we must distinguish from the tethered cord that is well known. Tethered cord is a descent of the cord that normally ends between the first and second lumbar vertebrae that we find more caudal. While in the occult tethered cord, the spinal cord ends in the normal position. The problem is that the patients have the same symptoms, which are low back pain, lower extremity symptoms predominantly with pain, cramps, stiffness, tingling, decreased sensation, even in the intimate parts. Urinary incontinence, I am talking about the adult part. While in children, urinary incontinence is prevalent, so apart from clinical evaluation, we had no tools to make an objective instrumental diagnosis because with normal MRI, everything is fine.
Instead, you have a particular diagnosis. Now, there is a new method to diagnose it and a new type of intervention.
That's right. So we followed what colleagues at Hiroshima University published in 2013, who used an MRI always, however, with the patient in the prone position. This assesses the position of the filum terminal and nerve rootlets to identify which patients are most likely to have benefit from surgery.
And precisely, you also have a type of surgery that is not particularly invasive, absolutely state-of-the-art compared to the traditional type of surgery in these cases.
That's right. This surgery we are about to publish in an American International Scientific Journal because it had never been described. It's a minimally invasive technique that with a cut of about 4 centimeters, we go to remove this red, which is a membrane, without the removal of bone tissue, below which we find the filum terminal, which we dissect by staying away from the meninges. The classic surgery involved general anesthesia, removal of part of the vertebrae, 2.5 hours of surgery, opening of the meninges, and the invasiveness also leads to increased complications. With minimally invasive in 25 minutes of surgery under local anesthesia, after 3 hours, the patient is up and going home the next day.
So we are talking about an excellence of our healthcare system, this kind of cutting-edge surgery that perhaps is not even known enough about. Let's say it is all paid for by the national healthcare system, and especially so there is no need to go abroad to spend high amounts of money.
Absolutely not. We started this minimally invasive surgery in 2010 in Italy, Dr. Genitori from Meyer Hospital in Florence, since 2007. Then we have included prone MRI in our protocol since 2014. And thanks to this protocol and spreading the news among the patients, because the doctors unfortunately know little about it, we have operated on about 100 patients from 12 Italian regions and also 2 patients from abroad. The last Hungarian boy who, through the European cross-border law, having recognized the Hungarian Commission, our center of excellence, brought him to Italy and we operated on him.
And operated at the hospital in Faenza.
Initially we operated at Lugo Hospital, now we operate only at Faenza Hospital.
All paid for by Italian patients, we were saying, by the National Health Service. And so, in short, excellence that is good to know about our healthcare. I thank our guest for this insight. We will go back to the service information.